All these clones, we the original.
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
The tourists come over to chill on the beach, but they don't come over the hill where we sleep. We got nightmares and they got fantasies. No sanity, it's just insanity. My mommy hoping nothing happens to me.
So you know what it is. Another episode. Things are interesting. First, I'd like to start off the episode saying R.I.P. to Chadwick Boseman. You know, obviously, if you know me, I'm a very huge. Well, first, I'm a filmmaker. Second of all, I'm a big anime and comic book and everything nerd. Third, you know that I'm the Bahamian Black Panther. So. But, you know, rest in peace, prayers to him and his family.
Right.
And everybody that lost somebody, because there's plenty of people I know that either lost a relative, a friend, or a parent within this last week. And, you know, this is just another crazy tale of 2020.
Right. We got a moment of silence.
Okay.
Let's give a shout out to for Nurse Bernadette Rowe.
Oh, yeah.
She was a friend and colleague fighting this COVID battle.
Yes.
So.
R.I.P. Moment of silence for all the ones we lost.
Mm-hmm.
All right. So, with heavy laden hearts and heavy minds, there's a lot of things that's going on in this country, around the world.
Mm-hmm.
And I know y'all wondering, Justin, what you did this time. You have someone next to you. They look like they dress in scrubs with the scrub shoes. I don't know what y'all call them shoes.
Well, they're nursing shoes.
Okay.
With my fabulous socks.
Nursing shoes with her fabulous socks. And yeah, we're about to get into some things today. Mm-hmm. So you know what it is? It's Lord Jalen Willard, the Sage. Actually, why keep on always using my old names? Well, it's Lord Jalen Willett, St. Anton Alexander, the Negus of Nassau, coming into you again with another episode of Erryting Kool. I ain't gonna tell you which day it is, but it's the exclusive edition. So, on the left of me, but before we get to her, let's introduce, I would like to call them the All Reliables. First, we have PG. We need to get you another nickname. And then we have on the next beside him on the cam and the board. Yesterday he was looking like the young Kareem Abdul-Jabbar. Skyhook Prince himself.
Oh my gosh. How'd it go?
How'd it go? What'd it go, Marco? So, on the left, we have... I don't know if we should tell the nature of our relationship first.
Oh
then
boy.
People realize, bro, how you keep on finding these people and how big network is.
Well, let's keep it a secret for now.
Yeah, we can keep it a secret for now. Wait, please introduce yourself.
Well, I'm nurse Arissa Fernander, and I've been in nursing for over 13 years, and I'm just here to let the public know that, you know, COVID-19 is nothing to be afraid about, and that we're fighting this battle as frontline workers, and we want you all to work with us. You know, help us to help you. And a little bit of the behind the scene, what's going on in nursing.
I feel like we should have had, like, Starbucks should have been open or something.
Oh, shucks. Yes, yes. A caramel macchiato.
A caramel macchiato. But, you know, we're about to get into some interesting things today. You know, after having a conversation with Arissa last week, I was like, you know, during these times, I always like to, you know, be conscious with my platform and have it as an avenue for people to voice their concerns shedding light on the things that's going all around us. And since we live in the Bahamas, we gotta shed light on Bahamian things. And speaking of Bahamian things, on this show, we like to have a very special segment. It's called the Bahamian word, phrase, or saying of the day.
Right.
And we always allow our guests to have a crack at that.
Oh boy.
The GOH.
Wow. What is a favorite Bahamian phrase?
What would you say on a regular day doing your profession?
What is Bahamian related?
Well, I'm so unorthodox at times.
Okay.
Give me that little thing.
Give me that little thing. Hey, I like that.
Have we had that? I don't
No,
think
we
had
have
that.
not had that. Give me that
Yeah, I'm always the one of the workers like, can we have this and can we have that? And
Right.
they don't understand that language. So, you go the local, give me that little thing.
Colloquialism.
Give me that little
Colloquial.
thing. Interesting. So, actually, what does give me that for our international viewers? What does give me that little thing mean?
Well, it means that for me, because everybody might have their own little
Right.
meaning. For me, is that okay? I don't have it now. I need it, so bring it on. Bring it so I can have it.
I am in need.
I'm in,
need.
yeah,
I get
you
it.
know.
Fulfill this need.
Yes,
That little thing.
yes. Give me that little thing.
Well, that's good. That's great. So, yeah, man, this COVID-19, we've been covering it since. I think it was we recorded an episode the day that we was like first actually being locked down. So
Yeah,
we've been
Yeah.
having episodes that line up with all that's going on so far. And
That was the boat interview.
No. No, I talking about the episode before that with Chelsea.
Was that it?
Yeah, that Sunday when PG came in, I told us. Yeah, told us like the rundown or whatever, and it both happened like a couple of days after.
Right. Okay.
So, but yeah, so many people have many questions about this pandemic. Is it real? Is it a hoax? Should I fear? Is this a pandemic? Are they trying to use this as guinea pigs for a larger plot? And, what is the agenda behind this? And also, as we've been going through this whole thing, a lot of things are being revealed about our society and our government as a whole. Just last week, it was announced that we're not going to be having any more lockdown. Well, actually, that happened.
Any more hard lockdown?
Any more hard lockdown.
I don't know what that means, but
I don't know how a hard lockdown is different from a
soft
regular
lockdown.
lockdown. So,
Lockdown is lockdown.
lockdown, baby. But, there's so much things happening and so many things revealed in one sector of our country, along, I think, with education, is our health sector has been very fragile for many years. And right now, we've come to a breaking point. So,
Yeah.
we don't specifically like to talk about these things because we're not in these fields to really know exactly what's going on. So it's always great to have a professional give us their point of view and their experiences in these different scenarios. So, Arissa, I like to start off with, what caused you to get into nursing? Because I've always been told that it's not a very profitable source, occupation.
Well, it really isn't profitable, and you really have to love nursing. It has to come from the heart.
Okay.
It really has to come from the heart. For me, I got into nursing because, one, my boss was a tyrant where I used to work. Nothing was ever good enough. Nothing was ever done efficiently. And so I was like, no, I need to get out. Then secondly, it was I had children and I needed a steady income. I didn't want, if the economy is bad, what will happen? How am I going to take care of my kids? And so I chose a profession that will direct a career path.
Okay.
Not just a job.
Right.
And go ahead.
Huh? Yeah, you had the funds, right?
Yeah.
No, because this is fine, left and right.
Cool. Yeah, like I was saying, you don't just want a job, because finding a job is like, oh, I can go to KFC, and I'm not knocking down any job now. I can go anywhere and get a job, but to get a career which can take me anywhere in the world, I can work as a nurse.
Okay.
And so I chose nursing as my profession. And it's a noble profession. It's a very noble profession. Anywhere in the world you go, practices are basically the same. You know what I mean? So it's good. I think it was one of the best decisions I've made in my life.
Okay, so how was the sector like? You know, because you've been in this for 15 years.
Yeah.
So I don't feel like these problems that a lot of people are complaining about is something that's happened overnight. I feel like this has been something that's been going on for a long time. And it builds up until it gets to a boiling point.
Well, it was a rude awakening for me at first, because even though it was a noble profession and I was like, oh, I love the white and how they look so clean and everything, it was a wake-up call.
Okay.
Because what you learn in the classroom, you basically couldn't carry out in your unit, in your area. And so it's like, oh boy, it's like fighting a battle within yourself. You know, you expect a level of care for each individual, and you expect equipment and supplies to be there to give this level of care. And then at some point when you get there, it's no equipment, no supplies, and a lot of nurses reach in their own pockets, even though we don't make a lot. We reach in our own pockets because of the love and care that we have for our patients. So we're not just waiting for the government to send this or management to send that. Sometimes we go all out on the limb, get it ourselves, so that we can give this best care to our patient.
Right.
You know.
Can I interject
Go
for
ahead,
a second?
go ahead.
Do you see like a parallel between nurses and teachers? Because what you just described, I think a lot of teachers go through, whereas like in terms of equipment or just materials they need to carry out their syllabus.
Yeah.
They wouldn't wait for, I guess, the teaching body, the principals to give them their budget.
Yeah.
They'd go in the stores themselves with whatever salary they have, as lacking as both of y'all are.
Yeah.
And they do it themselves.
Well, I can speak firsthand on that because my daughter is just going into teaching, into education. She just completed. She got the top award in education. Yeah.
Shout out.
Shout out to Shanae. And, you know, they fast-tracked her to her school to do her, what they call TP, teaching practice. Okay. And it was an alarm for me because what happened was when she got there, she got a classroom that was not up to standard. I don't even think that it should be classified as a classroom.
Right.
And then they want her to make it or transform it into a classroom for students to be in a learning conducive conditions. And I was like, oh my God. She sat down and she cried. And I was like, no, I can't have this. I'm going to help her. So we had to literally go and buy paint. We had to go and buy stuff to take molds off the walls.
Wow.
And it was just crazy. So it's basically the same in both professions, especially if you're just coming into it. I've seen it firsthand. I'm not talking about what someone told me. We went there together.
That's why I said, like, you know, I think besides education, right, the health system.
Exactly.
Like, you know.
And it's crazy because these are the two most important things that runs and drives a country.
Right.
Because the wealth of your nation is the health of your nation, and how do you get that by educating people?
Yeah.
And
making
that reflects.
People, exactly, make people knowledgeable.
In the temperature of the country right now.
Exactly.
You see how people take care of themselves, and you see how people...
like what they say and
right.
what dispute.
Yeah.
And that's very imperative because it's like, you know, we put so much focus on, let's just say it, like tourism and things like that. Like, okay, what happened when tourism ain't here?
Like now. Oh, we've seen it.
So
exactly.
Like, you know, now you see what's really important, and we have to put you can't, I don't think you can hold each ministry the same. It's like, you know, you must put more funding and imperative to the Ministry of Health and the Ministry of Education more than anything else, because it's like when you strip away everything else, whether it be sports, culture, blah, 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 obviously the infrastructure and works and things like that, it's like when it comes to the citizen, health and education are very imperative.
Yeah.
Right.
So
They go hand in hand.
But they need to be properly compensated. It needs to be an
Exactly.
incentive. Because if
Exactly.
you look at what Miss Fernander just said,
Yeah.
you have to have a love for it.
Exactly.
The love comes, but at the same time, in order for people who don't have a love for it, or you need them to build a love for it, you need to have an incentive in terms of money. So as long as those things go hand in hand, you have more people wanting to be educators and health providers.
And not even money, A lot of people, even though we need jobs and we need money, people want to know that they're there giving the best care.
Right.
And that we have the equipment. And that's what I have really been vocal about. Having the equipments to work with. Having the attire, the proper attire for the staff to work with. We don't want to say, oh, we're not going to work. We love our patients.
Right.
One of my patients told me that I'm worthless than a breast on a bull. And I thought that was so funny. But
Wow.
we love it because every day is something different that you encounter. But then when management is not backing you, is showing you that backing and that full support, it's like, why did I come into this profession?
Right.
Like I say, finances is a key, but it's not the only thing
Right.
that we advocate for.
Right.
Talking about advocating, we have our nurses union. And before, the union was there. Now we have Miss Williams, Amancha Williams, at the helm of nursing, at nursing union. And she's fighting. She's fighting to ensure that her nurses get everything that they need, to ensure that they have the best working conditions, not working 9 consecutive days. And within these 9 days, you have a nurse coming to work at 8 o'clock, leaving at 4. Then the next day, she comes back at 3 p.m., leaves at 11, and then they expect her to be back at work and effective and productive at
Right.
8 a.m. again. So you have a up and down ladder for these nurses for 9 consecutive days, where most of the public works 9 to 5, Monday to Friday. You have 2 days off consecutively. And so why, she's fighting because why does nurses have to do all of this, still give care, and then you want them to be shut aside or shut up?
Right.
It's sad. But thanks for the nurses union, because at least we have a fighting chance and we have a voice out there fighting for us.
Right.
So, quick question. So, is it that there's a lack of people getting into nursing? Why they stretch along for 9 days straight, or is it underfunded?
I don't think that it's lack of nursing, because every year we have a surplus of nurses that is coming out. We also have a surplus of nurses that we bring into the country from the Caribbean, from the Philippines. So I don't think that it's about the nurses themselves. I think it has to do with management and their ability to know how to schedule. They have been doing this for years and still can't get it right. So if you have a surplus of, say, 20 staff, which includes registered nurse, trained clinical nurses, and you can have 2 shifts. Why we can't do the 12-hour shift where we have a 8 to 8 or a 7 to 7, and then we have nurses that comes on and do the regular shift of 8 to 4, of 3 to 11, and 10:30 to 8:30, which is a night shift. And we can switch it up, and I think it will work. But they don't ever want to try anything that you try to bring forth to them. Even when, back to our union again, when our union try to be vocal for us, even the public turn their backs on us. And so when that happens, then we have no one fighting for us, So we're fighting a losing battle. So that's why we always ask the public, come on, listen to our cry. It's not always about the money. But like everybody else, we have bills to pay too.
Yeah.
We're out there fighting. We're taking care of your relatives that you leave there in our care. So obviously we're doing something that is you're trusting us
Yeah, it's a
enough,
valuable skill.
you know, and we go through a rigid training, believe me, and that's why so many countries are coming for our nurses. They want us, but you don't value us.
Right.
Management don't value us. The ministry doesn't value us, because if you did, then you would put things in place. You would give us the opportunity to prove ourselves. You know what I mean? By giving us our supplies, even as small as people may think, what is a PPE? A friend of mine called me, well, why are you running on about a PPE? I said, do you know how valuable a PPE is?
Yeah.
And according to our management,
Actually, not to stop you right there.
Go ahead.
Break down to everyone what's a PPE.
Good. I was just going to get to that. Sorry. So even according to our management, they say, oh, your PPE is your mask and your glove. That's not full PPEs. And it depends on who you are nursing and where you are nursing. So if you have a regular patient who have no infectious or transmittable diseases, then yes, one of the little blue surgical masks and your gloves is good. But when you take it up to infectious diseases where I can transfer it home to my family and friends.
Right. Or the rest of the hospital.
Yeah, or the rest of the hospital. Personal protective gear or equipment, which is PPE, is required. You need your N95 mask, which we didn't have. You need to have every inch of your body covered. You need your hazmat suit if you have these infectious disease. You need your head covered, your hands covered. So it would minimize, it's not going to eliminate it completely, but it will minimize your chance of getting sick and taking it home to your family getting sick. You know? So don't downplay PPEs, which is your personal protective equipment.
That's good.
We need those.
So what? Because there's always been a discussion of the nurses' lack of PPEs.
Yeah.
So what? Since y'all don't have the essential equipment, what have y'all been doing up until this time?
Boy, only God is with us and with me at this time that I am COVID negative,
Right.
even after working directly with COVID patients. I took it upon myself to purchase my own equipment. I got the N95 mask, I got the shields. They always say I'm old school. And so what I did was I tied my hair, I put on a cap, I put on one of the blue nets that they give you. You wear your mask, like a cloth mask like this, and then I put that over or under an N95 mask, as well as a shield. So basically my face is totally protected. Now for me, I always tell the nurses that I work with, get rid of the weave. The weave is nice, but if you look at it, when you're there and someone is coughing and they're next to you, isn't that spray getting onto your hair? And then what you do when you get home, you're not going to wash your hair because, I don't want to mess up my weave. And so I'm going to lay down, and then my face, it's on my pillow. And then when I put my face there, obviously I'm going to get infected. So either tie up your weave or take it off completely. I mean, I'm not against weave. Now, don't get me wrong. I love it because it enhances your beauty somewhat. But when you come to nursing COVID patients, you have to be really, really strategic and careful in how you nurse them.
Right.
Interesting.
Yeah.
Because from our conversation, what me and you was talking about, it's like, are we going to get to the whole Sanderman situation?
Oh, boy.
So, because I want to just touch on the PPEs and the whole, why is it this seems like for every government sector, like it's always strikes. We had, I think earlier this year, we had the junior doctors striking.
Yeah.
And then you guys, registered nurses, came out and walked off the job. Like, why do you think it's a grand disconnect with...
And then when was the striking? What was the date for it?
I can't honestly remember.
But it was sometime this year?
Yeah, it was this year.
During the entire pandemic part?
It was, I think we had one that was prior to the pandemic. And then we had a short sick out at the hospital at PMH.
People were getting infected.
They were trying to avoid getting affected. What they were really lobbying for was basic PPEs. Can we just have what we need to work with?
Right.
That's all it is. We need the equipment. That's what we want. And I can never say so much. There's always such a delay in the liaison between management and nursing when it comes to getting supplies.
Right.
There's always, and I always wonder why. And it's always some protocol that you can't get it, even though they know that you're nursing certain levels of patients.
And it's necessary.
And it's necessary. So why shouldn't these protocols just be eradicated with? Let's go. We know that, say, I work on Culmer's ward, and Culmer's ward has an outbreak. Why should I have to go through 1, 2, 3, 4 requests to get PPEs just for my staff to have them?
That should already be budgeted and carried out.
And then the government said that they got PPEs in March.
Okay.
So what happened to those exactly?
I was trying to figure that out myself. Where did they go to? Did they disappear off the face of the earth? They were donated to us, so why don't we have them? You know that COVID is here. COVID is not going anywhere at this time. So these things should be just like how you can send hand towels to the ward or the unit every day. These PPEs should be sent to us daily. We shouldn't have to put in a request for them. Because we don't know who we're going to come in contact with. And so even though our patients are there and they're not leaving, we are among other people out here. And so we have to protect our first priority is to protect our patients. And in order to do that, management should have those equipments there. We shouldn't have to be requesting them.
Because if you get sick, then what's the alternative?
Okay, so here's their alternative. The alternative is you go and quarantine for 2 weeks. No treatment is given. They're not giving you any treatment. You go home, you rest. You stay away from everybody. Their surveillance unit will call you, contact you. They'll inform you that. And by the way, surveillance unit is doing a fabulous job.
Okay.
Because it's overwhelming.
Right.
It's overwhelming at this point, but they're trying their best. They're calling you. They're checking on you. Have you been taking your temperatures? How are you feeling? Are you having the diarrhea, coughing, whatever, other symptoms? But you're sending people home to quarantine. But are they getting better? After 2 weeks, will they still be infected? We're doing testing. So if after 2 weeks you're going to be tested and you come back positive again, what happens? Do you stay home another 2 weeks? And then after another 2 weeks, what happened to the nurse again?
Right.
And that's what's been happening with us. They're sending us home. So what treatment are you giving us while we're home?
Okay.
So that we can get well to come back to nurse our patients. Oh, don't tell me just, the protocols are fine. I'm not knocking down the health protocols because that's around the world.
Right.
We're going to wash our hands. We're going to keep our social distance and we're going to wear our masks. But what else? What else do I need to do to keep me safe, keep my family safe, keep the people around me safe, and so that I can get back to work?
Right.
So
I mean, I know this might sound like a silly question, but are the people in management and higher positions, did they even practice or study in the healthcare profession? Because
That's not a silly question at all.
It's not. And
you providing these stuff.
You're right on
You
point.
have to think about like they would have to know that this needed. So did they ever practice and study?
And the thing is, you don't even need a PhD to think on that level.
Right.
You don't even need a PhD. And, speaking with anyone on the street, they'll tell you, you know what? I spoke with one guy the other day, and he was like, you know what, nurse? I've been around about 6 patients, and I was laughing at him because I thought he was just crazy. And I was drinking moringa. I always drink moringa, and that's the miracle bush, and he swears by this bush. And I was like, you know what? I'm going to try it. And I work on a unit where the people that I work with came out positive. I worked with them. I had my mask off around them. I was taking the moringa. I had 2 tests, 3 tests. all came back negative.
But-
So I don't know if that's gonna work. I'm not. I'm not.
No,
Just tell them
I'm
that
just saying.
Disclaimer, we're not providing no
Yes.
cure or
No,
anything
that's
like
not a cure, but I'm just saying that's
Yeah.
what I took.
add moringa to your daily
Daily diet
and see how that helps.
see how it works.
Right.
You know,
But
you
before-
can try basically anything.
But before we get in too deep, let's take a quick short break because we're about to get into a lot of stuff we ain't even touched the surface yet.
Yeah,
We'll
really.
be right back.
We still on the beach.
Should be a good episode.
Everything cool. Yeah.
Hi, this is your favorite Zaddy, Lord Jalen Willard from Erryting Kool, and this episode is sponsored by
Special sale alert, special sale alert, special sale for hashtag mask on by Bahamas. The Bahamas America flag mask is currently on sale for 20% off. It is the representation of the Caribbean roots between the 700 islands and keys of the Bahamas and all 50 states of the United States of America. Get yours today. But wait, we have the kids hashtag mask on collection now available and on sale. So log on www.bahawear.com. Get your mask and rep your flag. All right, so we're back. You know, I feel like we just touching the surface of things. So, we have Nurse Fernander with us. And Nurse, we left off the last segment with you talking about, using moringa. And let's dive into, some of the treatments that you could potentially use and what has been used in the hospital system.
Holistic medicine.
Holistic medicine, as well as the hydrogen chloroquine that people have been talking about.
Now I can't get into that.
Okay.
That's above, like they say, the Bahamians
Your
say, that's
pay grade.
above my
Pay
pay
grade.
grade.
Okay.
But what I can say is preventative measures
Okay,
that
that's
you
good.
can put into place.
Okay.
Like they've been saying globally, take your zinc.
Okay.
Make sure that you take your zinc.
Yeah.
And
Especially for men.
Yeah.
Right.
Yes. And what I incorporate with the zinc is I always take magnesium, selenium. What it does, it helps for easier absorption of these medication. So I'm on multivites with magnesium, calcium, and zinc, and selenium. So that's my daily routine.
Right. And what I didn't even know before is, it's very popular to say that calcium is good for bones and bone health, but without the proper ratio of magnesium to calcium,
Right.
you can't even absorb the
So,
calcium properly.
exactly,
And
exactly.
calcium is actually a negative without the proper amount of magnesium.
Oh, so that's why you see tablets have calcium, magnesium.
Right,
Okay.
but
Yeah.
milk that's fortified with calcium. Or fortified with vitamin D, whatever.
Right.
They don't have proper magnesium fortification in it to be able to absorb
For your
the calcium
body to
for your
absorb
bones.
enough.
So it's actually a negative.
So we're actually debunking that milk helps to grow healthy bones.
It does, but not the way
As
it
efficient.
is.
Sure.
Yeah.
I mean, I knew that. I don't really drink animal milk anyway, so yeah.
Yeah.
But so because like people like what's the like when we have patients that test positive for COVID-19, what's the next steps for them to get back to on their road to recovery?
Okay. Well, what I have been seeing, and this is maybe only for one or two patients, what they do is they try, because with this COVID-19 virus, what it does is it's like a mucus buildup. And because of this mucus buildup in your lungs, this is the reason why you're not breathing. You're having this breathing complications, which affects everything else. Because you look at the heart and the lungs are intertwined. So the heart sends blood, deoxygenated blood to the lungs to be oxygenated so that it will take it around the body. So if the lungs are not able to clear this blood, how is your body functioning? That's why you're having the muscle pains, because you're not having enough oxygen saturation in your muscles. And so what they're doing now is trying to treat the mucus breakup. So they're giving you stuff like dexamethasone. And then they're treating the infection. They have things I've heard, like the hydrochloroquine, which is also Plaquenil, and erythromycin. So stuff like that they're using. I'm not sure what else they're using because I haven't seen anything else. And I'm not a physician. I don't.
Right.
We're not prescribing anything.
We're not prescribing anything. I'm
Disclaim-
just saying what I've seen, and I guess they go from there. Basically, they use the oxygen to help you keep saturated, your oxygen level up, because sometimes your oxygen level can fall below 80. I've seen some going as low as 64.
What does that mean?
Okay, what happens is, they put a little thing on your finger and check your O2 stats.
Right.
Okay.
And that's the amount of oxygen that you have into your body. And, the oxygen is taken through your body via the blood. Right? And so what happens now, if your blood is not being oxygenated enough for it to circulate through your body is not getting the sufficient oxygen that it needs. And so when we check it, we see that, okay, he's getting low. That's why we put an oxygen mask on you.
Right.
Being low is that, like I'm saying, your body's not receiving the sufficient supply that it needs. And so that's what's happened.
Right,
And that's
and-
why we're having pain in our muscles.
So what are those numbers? Because you reference 80 and 60.
What we would have as the ideal O2 oxygen saturation would be anything above, say, 93.
Okay.
93% and above.
Okay.
So when you start going below that, then we have some concerns.
Okay.
Okay? Yeah.
Interesting. So when it comes to, because a lot of people initially wasn't taking this virus serious. A lot of people say that it's a hoax, it ain't real. What do you say to that as a healthcare professional?
Well, I was one of the conspiracy theorists at first.
Right.
Because you're on Facebook, because I'm a Facebook junkie as well,
Yeah.
and you're reading things, and sometimes you have to decipher between what is true and what isn't true. And then you go, for me, I like factual stuff, and so if I see something on Facebook, I'm gonna do my research.
Right. That's important for
I do
everyone.
my research, and so I saw the thing out with this billionaire and all of this, and I went and I did my research, and I was like, oh my God, for real?
Yeah,
this might be true.
He has a lot of a trail behind him, for lack of a better term.
Right.
over a
And
lot of
so
different issues.
You could believe a lot of the hype that they're selling you.
Right.
And so I'm like, oh my God, I don't believe that this thing is really for real. Until I started seeing videos of persons in hospital. And I'm seeing them with difficulty breathing. And I know what it is when you cannot breathe. That's like someone taking a towel and literally
Waterboarding you.
Yeah.
Right.
Just pulling and pulling and pulling until you cannot breathe at all. And I was like, this thing can't be fake. Everyone in the world can't be saying the same thing is happening. And we're here still saying that it's fake.
Right.
And so I had a group of guys. I had a group of guys at my sister's house, and I told them, I said, they were like,
Only on
why-
Erryting Kool.
why are y'all talking about this thing? I said, it's not fake. I said, if it's fake, come go with me to work then.
Okay.
Who you told this to?
So a few guys, they're conspiracy theorists.
Oh, yeah.
I
We have a
think.
lot of those out there.
Yeah, I think
yeah.
people are either taking one side of the extreme.
Yeah.
Yeah.
Either it's really real or it's really fake, but it could be somewhere in the middle.
But you can't blame them, because everybody is coming on television and just talking, just do this and do that and
Right.
do that.
Yeah.
And they're not really breaking it down
No.
for the little man, the little layman to understand. And so I start explaining to them. I said, are you aware of your anatomy? What goes on with your anatomy? I said, hold your breath for a minute and see what happens.
A lot of people can't hold their breath that long.
Exactly.
Right.
Right.
And so after a few seconds, everybody started coughing. I said, that is what is happening with these people,
Mm-hmm.
that they can't breathe. And so that's where the coughing is coming from. They're trying to cough to open up their airways so that they can get some oxygen in there,
Right.
so to help them feel better.
As well as a lot of people aren't understanding that this virus is attacking something that has been an ongoing disease for them.
Exactly.
Their mucous memories are
Exactly.
compromised
Exactly.
because of poor diet for a certain amount of years.
Believe me, we're at that level in the Bahamas where, in a way, I shouldn't say I'm glad that there's a pandemic, but people became more conscious,
About
health
that,
conscious.
yes.
People I saw people who never said they would put their hand in the dirt, start farming, start growing their own stuff.
Start running and working out.
Exactly, start working.
We just talked
I
about
used to
that
go to work
recently.
at 7 o'clock in the morning, and I'm seeing that. I was like, oh my God.
A drove of people.
A drove of people just to get out of the house,
Right.
which was
Yeah.
good. And that's why I was like, I'm all for the lockdown. And, just give
Right.
people an inch and then let them come out. Let them start exercising. And then their health becomes more important because we didn't even think twice about our health. Oh, we want to go into the food store. We're going to get this big roast and we're going to cook
All the
our
junk.
peas and rice and our macaroni and our coleslaw and our fried plantain. And then we're going to top that off with a Coca-Cola. And that was the best dinner.
Like clean your car, cola.
Right.
Clean your
Right.
car and don't say what
Yeah.
you had for lunch and breakfast.
Oh gosh, and and people never value their health, and in a way, and they always say you're crazy. In a way, I'm glad that the pandemic occurred.
Yeah.
It make us wise up.
Yeah, it's sort of like a hurricane.
Exactly.
Yeah, help you to value life, and by valuing life,
Exactly.
everything is a trickle-down effect.
Exactly.
But I don't feel like people value their health because they're not taught to. Nothing in our,
society,
economy, our
yeah.
culture teaches us that these foods, however good they are and however based in our culture they are not very conducive to long-term health.
But
You can have them as you do, but also have other things to counteract those things.
and that starts at the top.
right.
Yeah.
Because who's allowing this type of stuff to come into the country? It's not you and I.
No.
Who has that power? So it starts at the top. So when someone is sending in and you're getting all these monies for all this imported good, why aren't we looking at what is being imported? Why don't we put a cap on? Okay, you're not going to bring in those noodles. We know that they're not good.
Yeah.
Right.
But what are a family, a single mother of 6 going to buy when she goes to the food store?
Right.
And she has minimum wage.
On $2.10 a week,
$2.10 a week.
$5.25
Okay.
an hour.
But
So-
not even just the import thing. Why no one talks about us growing our own food?
Well, I was getting to that. But see, the thing is, we have to start where it hurts first. We have to start at the top where the government, and everybody like to say, we point the finger at the government. They are the decision makers in the
Right.
country.
They develop the infrastructure
Yes.
on which we build on.
Exactly. And so they need to determine, okay, we're putting a ban, just how they can put a ban on plastic, we can put a ban on all these old bad
Right.
foods.
Right.
And then we can start, I see they have started the initiative of backyard farming, giving people...
Shout out Sustain Your Belly.
And all the other people out there.
Exactly.
Right,
right.
You're giving people a handout, not a handout.
Right.
Bahamians have been given a handout for too long.
Yeah.
From 73, it's always baby me, baby me. We give you an education. We send you to school, we give you free education, we give you free books, we give you this. Now it was a problem with purchasing your own book after a while. So now we need to learn. We've already learned to creep. Now it's time to walk. We're running. Give us a handout. Don't give us a handout. Give us a handout.
Yeah.
You're right.
And by giving us a handout, we are able to help ourselves. We can be sufficient and efficient in growing our own foods. Even if it's just subsistent farming where we are able to maintain grow food for our own families.
Yeah.
Right.
You know what I mean?
Communities.
So that's where it starts. But it starts at the top. And nothing is going to change if their thinking doesn't change. Their mindset has to change in order for anything else to change.
Okay.
Yeah, and I think to piggyback off your whole, it starts at the top. Even the collective placing emphasis on the Ministry of Agriculture
Yeah.
or whatever. Like, we need Yeah, but even coming up in school, everybody frowned upon having a job working a farm because we was worried about being too black. But it's like, fam, you gotta
Exactly.
grow your own food to eat. Who gonna eat?
Right.
Or whatever. And like, we place more emphasis on being the doctors, the lawyers, the things, but we didn't focus on the little things. Like
Exactly. What was
the farm.
necessary?
what was necessary. And now we in that spot because now, okay,
Exactly.
we have these lack for jobs. So now it's like, okay, what are we all going to do as it pertains to providing employment and things
We're
of that
still
nature?
lost.
Right.
So we got to get back to the farming and things of that
Yeah.
nature
Right.
and get into it because I was soon about to start my own like little backyard farm because it's like, yeah, along with this pandemic, we may incur a food shortage at some point. Mm-hmm. So it's like, what you going to do? And the price of living going up and up and up, and people ain't working, and people getting sick.
Yeah.
And we have one of the highest obesity rates. I mean,
Oh gosh.
however we feel about Dr. Sands, I agree with him when he say y'all think y'all sexy, but y'all just fat. Or whatever.
Oh, Dr. Sands is wrong for that. Shouldn't tell us that.
No, but I didn't feel him
I-
on
This was
that.
blunt.
I feel, yeah,
you was blunt.
he had to say that, and coming from his perspective, he's seen it, and I can take on and accept what he said because you know why? He's seeing the people come into his office. He's seeing the people come into the hospital, and you would tell these people what needs to be done. And they think it's just the medication can do it for me, and that's it.
Mm-hmm.
I will take my medication, but I'm still going to eat my fried
This and that.
chicken and
Yeah.
my peas and rice.
Yeah, well, don't make no
And
sense.
so he had to be blunt.
Right.
Because how high the diabetes rated?
Oh, boy.
Until it starts
highest in
to
the region,
affect their health in a way that they
Right.
can't
Yeah.
escape it,
Yeah.
then they'll decide to find
Make
alternative
changes.
ways, right?
And then
it may
it's
be too late. Yeah.
And then they come to the hospital and they expect nurse. Oh, you had me here waiting for so long. They caused me cut off my foot. But how long have you had diabetes and
Yeah.
the bad health lifestyle
Right.
that we told you don't do this, don't
Right.
do that, don't do that. Now you're here to get your foot amputated.
And-
And what happens? You're blaming the nurse and the doctor
Right.
Yeah.
for your own
Someone else.
inconsistencies.
So there's always a lack of accountability.
Exactly.
And then they can
Exactly.
be like, oh, this hereditary, my fam, this and my fam. I'm like, fam, no.
No.
How you could be born with faulty organs? I want to know. Because it's like, when it comes to diabetes and kidney failure and heart disease, you're overwhelming your organs by what you put inside your
Right,
body.
but that could be inherited to some degree
Some
if
degree.
your parents also had an unhealthy lifestyle because
Yeah.
they take on whatever you have inside your body.
Yeah.
It's inherited, right? But there are ways and things that you can do
counteract those
because
things.
for me, I know my mother. My mother is a diabetic. She's diabetic. She's hypertensive. She has peripheral vascular disease, and so I know now. I'm off red meat. I'm not eating the
Actually,
red meat
that runs
in the family.
in the family.
I'm off the red meat. And so I try to make a diet where I'm not going to, it'll be very, very hard for me to go down that road.
Right, because you're eating to live now.
Right. I'm eating to live. And so my morning routine now is, besides the vitamins, I do ginger, garlic, lemon. I steep that down. Mornings, I drink a cup of that.
Nice.
And if nothing else gonna make you cough, that will make you cough.
Right.
I can imagine.
Because that clears your chest. And,
Yeah.
and for the rest of the day, I'm feeling good because
Right.
my chest is clear.
And then we spoke about this earlier about one positive thing from the lockdown last week was all fast food places were closed.
It was closed and everybody was
Lord.
cooking.
Seriously.
Wait.
But it shows how much people depend on those things because a lot of people talking about having withdrawals.
Yeah, legit withdrawal. Some people do have.
Yeah.
They can't wait for Monday to
I
go
just
to
gonna
Bamboo
say,
Shack
it
and
can
go
be
to
active.
Wendy's
It
and
can
go
be
to
active.
KFC.
Listen to me, folks. Don't do it. You know why? Those things been there from how long?
Right.
Yeah.
Right.
How long?
They're not
In the
thinking of that.
freezer.
They're not thinking about that. And
No.
I'm like, the last time we were shut down and all of Wendy's was closed, and I went to Wendy's for a burger, and I was really running late that morning, and I said, Jesus, I don't want to eat this. I honestly don't. And I went there for a burger, and I started to bite into the burger.
And you could smell it.
I could smell it.
Right.
I could
Oh, my
see it. You could
goodness.
see it. And I was like, I called back to the office. I said, you gave me a burger that has, well, I wouldn't say mold, but
Yeah,
it had
but
some
it
stuff
wasn't
in
spoiled,
it.
right?
It was not good. So if you choose to go out there and you want to
That's
have your
on you.
burgers and your Wendy's and your McDonald's, I'm not knocking any
Man,
franchise.
make your own food.
Do it at your own risk.
Just make
Do
your
it,
own
Yeah.
you know.
Yeah.
Just cook.
And you save so much money.
Yeah.
The thing is, I've been, I talk a lot.
No, you on a talk show.
It's the
You know,
platform for talking
the
about
thing
it.
is, pizza. Every Friday and Saturday, I ordered pizzas for my children, and we paid up to $60 for pizza.
Could you imagine just paying $20 for the ingredients for the pizza?
So that's what I'm about to say. So I went to the store the other day, and I was like, you know what? I opened up my phone, and I was like, oh, these are the ingredients. So I got all the ingredients. I got
Right.
2 bags of flour. I got some yeast, some cheese, and everything. And it came up to $60. And I was like, wow. We're still making pizzas, and this was about 3 weeks ago.
Wow.
Right.
That's
So you
it.
get 3 weeks worth of pizza
That's
for the
it.
same amount as
Exactly.
a
And
weekend.
we still have more ingredients. So, folks, the best thing to do is make it
You
yourself.
can make it how you like it.
Exactly.
You don't have to deal
And
with
you know what
nobody.
you're putting in it.
Exactly.
You know exactly what you're putting in. We was just talking
Exactly.
about this while we on this point. We was just talking about this the last recording that we did. It's like, even with the lockdown too, your body should done adjust to a different eating habit anyway.
Yeah.
We was talking about this our last recording. Like when we offer a certain food for a while and we go back to eat it, your
You gonna
body
be
just don't
sick?
accept it
Make
the
you
same
sick.
way. You know?
Make you sick. And-
Anything that your body, sorry to cut you off,
No, go
anything
ahead.
that your body rejects
Yeah.
should give you like a mental flag. Like, okay,
Right.
should I
They
be
shouldn't
eating
be
this?
taking it.
Right.
Right. Yeah.
Exactly. Even the type of seasonings that we use in our food. Bahamians always overdo everything.
Right, right.
I'm
Too much
sorry to say
sodium.
my Bahamian
No, you
people,
right.
Right.
but we overdo it. Basic stuff. I stopped purchasing, I never did, the accent. That is awful
yeah.
for your body.
I don't know what that is.
Accent. That's
The
what
brand.
I
Accent
even-
is the brand, but
Yeah.
Right.
What
it's
type of
the
seasoning?
MSG.
Yeah,
Oh yeah.
It's awful. The complete seasoning is awful. If you cook food for me now, you don't have to tell me what you put in it. Just give it to me.
And you can
And the
smell
minute
it.
if you
Good
give it to
friend.
me and MSG is in it, my entire bottom lip starts to swell. Because
There it
I
is right
haven't
there.
eaten
Right.
it.
There it
And that's
is
why I
right there.
can't eat out. So your basic lemon, pepper, black pepper.
Wow.
And you
Sea
have
salt.
and salt, that's it. What
Right.
more seasoning do you need?
And then what's so interesting about all of that too is a lot of people say they can't live without eating meat, or meat is such a
Yeah.
vital part of their diet. But if you ask them to just cook the meat and eat it by itself, they can't.
They
No.
can't.
Why?
So why?
Because the missing ingredient
It's
is
just the seasoning.
The seasoning,
All of that.
and the
Right.
seasoning come from herbs, plants, and spices.
Yeah.
Exactly.
So, do you really like the meat, or do you like the taste
Yeah.
that you
Right.
add to the meat?
Exactly.
And that's really the reason why I became a vegetarian. Because it's like, you just like how it tastes in certain textures.
Right.
Yeah.
But then it's like, when you consume that and you make it, you realize how it feel, you make your body feel, it's like it ain't worth it or whatever. So, but like I was telling Marco the other day, like I lost so much weight in August. Like, yeah, even though I'm vegetarian, I'm still eating out, but it's like just being home and cooking your own food
Yeah.
and you know, because people be putting, let's say for instance, people will be cooking a recipe but making it taste the way they adding sugar with it. Like,
Yeah.
Right.
yeah, like,
Yeah.
you eating all this sugar and you don't even know because you thinking, oh, it has to be like a pastry for it to have sugar in it.
Right.
But I might have put sugar in this pizza or put
Enhance
sugar in
the
this,
flavor.
like,
Yeah.
they hit it a different way or putting extra stuff. But it's like when you cook your own food, not only does you help save a lot of money or whatever, like, like, okay,
You have
like,
complete control over what
over
you're
your
doing,
food,
and
like,
putting in your
exactly.
body.
like I bought like a whole bag of quinoa like last week from
It's so good. So good.
Cost Right. All right, so okay, yeah, you might go out and get quinoa, like a serving with something for like $10 or something. Then okay, that's one serving of quinoa along with whatever you
Right,
got.
right.
But if like okay, I paid like $8 for this big bag and all that. One
it's
serving is a
good.
cup.
It's good.
It's like how long that can stretch because okay,
Exactly.
I can split 2 cups in one meal.
And then you
Yeah.
can replace that with a lot of people like that. eat white rice.
Yeah.
Or white rice is not.
Couscous.
Right.
Right.
Couscous and quinoa. And it's so good. Like, my kids was like, when I first started with the new trend of cooking, and I was like, we're going to have quinoa salad today. Oh,
Yeah,
my
what's
God,
that?
what's that?
Right. It's
And, we
unfamiliar.
don't eat that. And so I said, what all do you put in it? I said, I went to the store and I got some green peppers, some yellow peppers, you know, all the little colorful
Yeah.
peppers, and you make it fun because it has to look enticing to eat.
Right.
And then you add a little balsamic vinegar and a little olive oil, and you just mix it, and it's really good. Twist of lime. And they were eating it. And I was like, I did some salmon too. We don't like salmon. How could you not like something
That you
that you've
haven't
never
tried.
tried?
Right.
And so it's all in the flavoring and the seasoning, like you
Right.
say. That's all it is.
Interesting. So would you just consider like converting to a full plant-based diet?
I would love to. The thing is, timing and getting your stuff prepared is my biggest challenge.
Right.
And because of the way I work, I have basically, in a day, besides the weekend, I have about 3 to 4 hours a day that is free. And that's while I'm on the road transitioning from one
Wow.
place to the
So
other.
that's not even like a idle
Yeah.
time.
No.
Wow.
So keeping up with that would be tough at this time, but it also has to do with preparation.
Yeah.
So if I can prepare meals on the weekend, like I'm off now, and I'll have them during the week to take.
Right.
Yeah.
Yeah,
Right.
because it's all about like food
Yeah.
prepping.
But it's no problem with transitioning from animal-based to plant-based
Right.
diet.
It's really just a mindset.
Yeah,
As
that's
long
it.
as you're
That's it.
prepared mentally, you could
That's it.
go
And
through it.
also, you know, your skin is totally different.
Self-control. Right.
And so since I've been I've been having a lot of breakouts and stuff because now
You're not
my
transi-
body is
you're in-
detoxifying itself.
Yeah.
Mm.
In that transition period.
Yeah. So
Yeah, a
I'm
lot of
really-
times your body tells you things, but one, we don't know how to listen to our body
Exactly.
or we ignore it.
we ignore it. That's
Right.
exactly
So
what
there's so
it is.
much things happening that we uneducated about, and people like yourself could be, if you were put in a better position to, could inform everybody.
Yeah.
But either they're not listening, they're ignoring you, or you're not being empowered to give that
Well,
information.
that's the thing. That's the thing. That's exactly what it is. We as a society, we seem to not be empowering the things that we need to be empowering.
Right.
We empower things that are easy, not that is right.
Yeah,
That-
I
that-
yeah,
that-
yeah,
that-
I
that's
let
what
that
it
sink
is.
in.
Yeah.
Once you
Right.
let that sink in, yeah, that's
Yeah.
true.
And that's so true because we always like the easy way out.
Yeah.
So another thing. So now we're in this pandemic. We don't see for the foreseeable future. We don't see the end of COVID-19 unless we have a vaccine / cure. What's your thoughts on that? Because a lot of people, there's a lot of hysteria around taking a vaccine and a cure, and there's a lot of evilness and craziness what I see going on in the world where everybody trying to fight to be the first person to
To bring
make
out
one.
this vaccine. Well, see, the professional side of me would say take the vaccine. But after they've done enough research with this vaccine, they've done enough clinical trials with this vaccine. If it's effective, yes, take the vaccine. I would advise that.
Now.
Now, let's get real.
Yeah.
Now, let's get real. On the other hand, as a conspiracy theorist, I refuse to take the vaccine. Why? Because, like I say, back to the clinical side, there haven't been enough clinical trials to say that, okay, this vaccine has been working, this vaccine has been around for such a long time, blah, blah, blah. We know all the side effects, and we know how to deal with the side effects. So, yeah, I think I'm going to stick with the conspiracy side of it for now until it's been proven that, okay, we've done all the trials. This is what's happening. Yes, you can take the vaccine.
Okay, so just define for the audience, what's the difference between having a vaccine and having a cure for something? Is there a difference?
Yeah, bro.
Go ahead.
Oh, okay. I would say a
Go
cure is just the eradication completely of whatever you're trying to fight. And a vaccine would be the preparation to prepare your body to fight it in the future or to prepare your body to fight it in the present. So if we have the COVID-19 going on right now, if you take a vaccine, your body, according to what professionals tell you, your body would develop antibodies and your white blood cells would be prepared if the virus enters your body. You know how to identify it. You know how to attack it. And that would be the difference. If you have a cure, then COVID-19 can't do anything to you. You wouldn't even have to be prepped for it. You would just take it away.
So, so is what Marco said is true as it pertains to the difference between the cure and the vaccine?
Yeah. So, like I was explaining, we have your regimen of vaccines starts from birth. So you get your first virals at 2 months. And so you have your, can I remember now? Stuff like you have your MMR, which is your mumps, measles, and rubella. But I don't think that one starts until 12. You have your DPT. I can't remember everything.
Right.
I can't remember all.
Doing your
but
best.
you know, they are introduced to you from an early age, and like what he was saying, it prevents you from getting. I don't know if it's really a cure,
Interesting.
but it's a preventive measure or mechanism.
Yeah.
And so with this COVID-19, the question we should be asking is, okay, if I get I have already had a positive results from the COVID-19 virus, and I get this vaccine, will this virus still be living presently in me, and would it be able to rear its head again in the future? Because, you know, like syphilis. Syphilis is a disease that can lay dormant for years.
Right.
Yeah.
And you can be 60, 70, and it rears its head. So we'll have to see how this thing works.
Right.
And that's why I'm very skeptical about the vaccine. You know, I haven't had the chance to do any research and read up on the different vaccines that they're producing.
And it's a lot.
I really can't.
It's a
I really
lot.
can't speak to that.
Right.
And I'm not a virologist. I'm not an epidemiologist. Just to be clear, because you know, Bahamians will come for you.
Right.
They will.
They will come for
They
you.
have a lack of information, so
Yeah.
they skeptical on any information.
Exactly. And so I really can't speak to that. But like I say, we have been using vaccines for a while.
Right.
Yeah, I mean, so my whole opinion on the vaccine is, you know, just like what you said, because I see a lot of different companies worldwide, like, you know, Russia has their own variation of vaccine. What's that? It's an African country that came up months ago that said they have a treatment for it. And I was like, hold on. So everybody trying to have a vaccine and everybody trying to, I'm like, nah, y'all about to skip some steps with
But
this. and
Have you
stuff like
ever
that.
thought, not cutting you off, have you ever thought, it just came across my mind just now, since you said different country, we're different ethnicity of different
Right.
We're a different race of
ethnicities.
people.
And so I
Yeah.
guess
They should
that would-
affect everyone differently.
differently.
Right.
That's
Yeah.
what I'm feeling. And so even if they're doing it like that, yeah, because then persons in Africa can, you know, test their people and see how their reactions is.
Yeah.
And, you know, they have a lot of diseases that they've been dealing with.
Right.
Yeah, so they are
And
accustomed to.
challenges, and they've overcome it. So,
Yeah.
I mean, that
I can understand that.
you know,
But, like, you know, that's what a lot of people are fearful of. And then, you know, also the conspiracy element of it where they're saying you will be chipped.
Right. I mean, my idea with all these things is
Yeah.
we have to trust these people.
yeah.
Yeah.
And it's very difficult to trust people that have been untrustworthy in the past.
Yeah.
So you have to develop that trust all over again. And if I don't trust you and I don't understand what's actually in a vaccine, and then I've been made aware of what is in a vaccine later on. So
Yeah.
it's a lot of pretty nasty stuff that goes on behind the scenes.
Yeah,
So
'cause not even-
I don't want to corrupt my body,
Right.
you know, for what somebody says. I'm not going to take your word for it.
Yeah.
And not only just that, not even just with this vaccine, previous vaccines,
Right.
there's been research that's been led to, children having different mental deformities
Right.
and things of that nature. So it's like, hold on.
Speaking of India and the billionaire who's here,
Yeah.
he's banned in India right now.
Yeah.
Interesting.
But you know, I mean, medically, everything that we take has a side effect.
Right.
That's why I say,
Everything. Even vitamins that we take, if you take too much of it,
Right.
I take the GNC Ultra Women, Mega Women,
Mm-hmm.
and if I take 2 tablets, I'm really dizzy.
Right.
So anything that you take all medications has a side effect.
Mm-hmm. It could be a poison or it could be a cure based on the
Exactly.
dosage.
Based on dosage, based on how your body reacts to it. So,
yeah.
like I say, it's
I mean, I ain't
skeptical.
really mind that, right? But I'm
Yeah.
I always look at the long-term effects.
Yeah.
Because obviously, like he said, like, it depends on the dosage. It
Yeah.
could be a cure or a poison.
Yeah.
Right.
But what is the long-term effects of people putting these substances inside their body?
Well,
Yeah, it might not catch
Depends
me right
on the
now.
ingredients. We don't know what those
yeah,
ingredients
and
are.
it ties back to so many things. Like
Mm-hmm.
I said, the ethnicity of people. But we've been using vaccines, and we've been healthy so far.
So far.
Because
So-
from 2 months, you're young. They're telling you don't give you sodas at 2 months, but they're
Right.
introducing a vaccine at 2 months.
Right.
Yeah.
That makes sense. That's crazy, right?
Yeah, that's
Right, but a
that's
lot of
extreme.
people don't think about those
That
things.
sounds-
Yeah.
I mean,
Right, but we have
Yeah.
health officials who we put up there to say
Exactly.
you're the educated person that we go to
And-
for this.
But you know, even when, I don't know if any of you have children, but
No.
even at 2 months, when you give those children those, they're sick.
Yeah.
They're sick.
Are they sick because of the vaccine? Or
They're
They
sick
are.
because of the vaccine. You take
Interesting.
them there to the doctor and they're fine. And then at night, they're burning up with fevers, some of the same symptoms.
Man.
and you know, there were some vomits, some, you know, they have different reactions. But in the long term, it's been working.
Right.
Because it keeps them protected from the measles.
But you have,
Some rubella.
you also have some people that under the impression that they introduce diseases that rear their head later on in life,
Exactly.
like measles, like
Exactly.
chicken pox, like scavella. What's the
Rubella.
rubella?
Uh-huh.
It's like a S word that is similar to measles and chicken pox.
Oh,
I can't remember the
scarlet
word.
fever. It's basically
Something
the
like
same
that.
thing.
Yeah.
Oh, we haven't said that in forever. Thank you, Lord.
Right.
But I think like I
Autism
say-
was a big one
yeah,
as well.
I was just about to say that. There's a negative side to it too. So some people refuse to get their children vaccinated, and which is going to put the children who are vaccinated at risk. But that's their choice.
Right, but I always had a confusion with that because if you're vaccinated and you have the proper protection from the virus or whichever disease that you're protected from, how is somebody who is not vaccinated
A threat to
putting you at risk?
Well, like everything, and that was one of my questions as well. I
Right.
really didn't get an answer for that, but from my perspective, what I'm feeling is that at a certain time, I guess those vaccines wear off. I guess I don't know. I'm not sure.
So if they wear off, why are we taking them in the
But
first place?
It's a preventive measure.
Right.
It's like okay, you know you're gonna go in the rain. You're gonna put on a raincoat. It's not gonna fully protect you from the rain,
Right.
but you have some protection.
Okay.
But then
That's how you have to look
your
at
body developed those antibodies with the vaccine.
Right.
And
And
if
so-
I'm non-vaccinated and I get sick, I also develop those antibodies naturally. So
Right.
both of us in both scenarios develop those antibodies.
I guess.
I
don't know.
No. I'm not trying to grill you.
No,
just
I know.
Yeah.
I understand.
Yes, ma'am.
That's where I'm at too. And I'd be confusing myself sometimes. I just sit down and I'd be thinking, but what
Right.
if?
Yeah,
but
yeah.
This is what is happening. But then what happens? And then
Right.
we get to so many questions. Then it's
That
like
unanswered
where
by the people who are supposed to have the
supposed to
answers.
have the answers, and,
And-
then they look at you like,
Right.
"Oh, Fernanda,
Yeah.
you're always the one who always have the problem."
Right, but then some people turn their brains off
Yeah.
because they get this information. It's
And-
coming
and
from
it
the
starts
place.
there, and they're not
Right.
questioning
No.
what is happening.
And that's where the problem is. That's where malpractice could possibly come in because
Exactly.
everyone has to be informed at every level,
No.
not just the doctors at the nurses because y'all the ones that are actually administering these
We
things.
administer it. And then we have to have an explanation to you when you come as a parent. You bring your child at 2 months. Why are you introducing a germ to my child?
Right.
What is the reason? Oh, it's for their protection. But what protection?
Right.
And then
If everyone else has already been protected, my parents have already been protected. So we should be eradicated of this disease
Right.
now.
Yeah.
So why are we still trying? So it's so many questions that people have that we wouldn't be able to answer.
Right.
You know, and that is where the dilemma come with all this conspiracy.
Yeah.
theory.
yeah.
Yeah.
And then also a conspiracy could be within the vaccination of children. It's like, y'all making my child sick, so now I gotta pay to go take them to a doctor and pay for medicine, and
This and that.
Yeah.
it was fine. Like,
To the
you know,
conglomerate.
Yeah.
like you
But,
know,
that's what it is. That's how the world turns.
Yes,
You know,
right.
the pharmaceutical companies are making the big bucks. They determine that the billionaires who are behind the pharmaceutical companies, they want more, and they will continue to want more. And we continue to be the guinea pigs.
interesting.
Sad to say it like that, but that's what it is.
So what in all of this, because we have had a mouthful, we already in almost over an hour
Yeah.
into this. So what made you want to speak out for your fellow nurses and health officials everywhere
My
on these different issues?
My biggest thing was after the passing of a colleague. I mean, we had deaths with other people, and I'm not downplaying anyone's death because every life is valuable. Let me get that out there first. The thing was why I spoke out is because we've been fighting behind the scenes of this virus, and we're doing our best, and we want to go to work. We're willing to come to work, and negligence is the cause of that nurse death. Negligence. And that should never be for persons who are working frontline, persons who are willing to come to work, persons who are willing to risk their lives so that they can help save another life.
Right.
So then that person should be prosecuted, or that this body of
Well,
people
the
should
body
be
of people
prosecuted.
should be prosecuted.
Right.
It should start from the top, from the minister, because he should never be the one to say, oh, well, I didn't know.
Nah, that
You know,
never should happen.
just how you're on the ground campaigning for a vote,
Right.
every vote counts. You should be on the ground campaigning to
For
your
lives.
line staff for our lives. Every life matter. You know,
All-
nurses' lives matter.
No, all lives matter,
All
bro.
lives
That's
matter.
a different conversation,
Yeah,
but
that's a whole totally different
Right.
conversation. That'll take another 3 hours.
Nurses' lives.
Nurses' lives
true.
matter.
Yeah.
And if you're so concerned that you're at the top, you know, come down. Put your high hat on the side for a
Right.
minute. And come down. Speak to the nurses in the trenches. Hear our cry, because the management is never going to come and sit around the table with the ministers and the big bosses to say, oh, yeah, well, Nurse Fernander has this problem with her unit and this is what is happening. No, they're going to tell them everything is fine. We have it
Straight
covered.
people.
right.
You know? So it takes one little thing of just speaking with the people who are in the trenches working,
Indeed.
finding out directly from them, saying, okay, I'm the minister and Nurse Fernander, I'm sorry to hear your plight, but you know what? I'm going to put pressure on your bosses to ensure that you have what you need.
Right.
Yes.
And that's where the respect comes from. So you have the minister of health, you have the director of hospital, public hospital authority, all of these people. You have you have the hospital administrator, you have the principal nursing officers, then you have your supervisors before it even gets to us. And all of these people have to send approval for me to get a personal protective equipment.
Right.
That's ridiculous.
It is.
When
Very.
I'm working in the trenches every day.
In the trenches.
Because
We're into trenches because we're
In the
fighting
war.
a war here.
right.
Yes.
And then you acting outside, because a lot of people like to say you acting outside of your pay grade when you demand more than they think you need.
Yes.
Yeah.
But when you do more than you're required to do based on your
You're not
description,
acting-
no.
Right.
Exactly.
So that's
Exactly.
I don't understand
You know?
what
And it's ridiculous. It's ridiculous. I know I will be victimized for speaking out. I really don't care.
Right.
My care is for myself, my family, and my patients. Like I always tell them, it's never about saving money. Management needs to stop that.
Especially
stop
when it comes to the health of people.
Exactly.
Yeah, how are you saving money when you jeopardizing health at the same time?
putting
If
Isn't
health
that literally against your the
Yes.
whole point of a hospital?
really a
Exactly.
reverse sword, a double-edged sword.
And that's why I say it's negligence. So put lives first. Money will come later.
Right.
Because if you save lives, automatically you're going to make the money.
Right. But the point of a hospital is not to make money.
Well,
I mean, depending on what kind of hospital it is.
No,
Yes.
no point of a hospital. The point of your hospital is to do the job that a hospital
right.
does. Now, if you make money, you make money. But that's not the point of the hospital.
that is
You-
not supposed
Who you
to
gonna ask?
be.
That question to be like,
A hospital is not a business. It functions as a business,
Indeed.
but it's
Bro.
not a business.
well, okay, I'm saying,
They saying,
who you asking? Like,
Yeah.
No,
you know,
I don't. No, I don't
That-
care. I
that's
don't
your
care who.
concept,
Right. I
though.
don't
Yeah.
care who you ask.
Yeah.
A hospital is a hospital.
That's what it's supposed to
It
be.
does what it does,
Yeah.
right? It could also function as a business,
Yeah.
like the duality of it. You
But
can make money,
You know what they're going to ask you?
right? How are they gonna?
If we're not supposed to function as a business, how are we supposed to pay our
Operate.
electricity?
no, I'm
Their
not.
operational
that's the
bills.
catch-22, right?
I'm
How
not
are we
telling
supposed
you-
to buy the medication for these people?
I'm not telling you not to function as a business, but that's not your priority.
Well, that's
But that's what they
That's
look
what
the
at.
priority.
Niggas, right.
That's,
It's like,
and
bro, how
that's
we
why
gonna
I'm
make money,
saying
bro?
the whole concept of the healthcare system has been flawed. It is flawed because when you're more worried about
the dollar.
your
Your bottom line,
institution
yep.
and your finances, then you're really not into saving lives.
No,
You're not into saving patient lives or nurses' lives.
right?
Or any healthcare. I shouldn't even say nurses because we are healthcare workers. We have persons in the laundry who have
Yeah.
to come and take those individual clothes who are infectious
Right.
to
Yeah.
wash. We have to worry about the persons who come on the unit to collect the garbage. They are at high risk as
Or
well.
even your cafeteria staff.
Yes, the persons who are cooking the food because
Yes.
those plates and trays has to go back to the kitchen. We have to worry about the maids. So I'm here advocating for everyone in healthcare, not just nurses, the maids, the garbage collectors, the gardeners, everybody who have to come in contact with those individuals,
Right.
patients.
Because every time I go in PMH, I'm not afraid, but I'm very wary on just the sanitation conditions in the
Exactly.
hospital.
Yeah, yeah.
I feel like it's unclean.
Yeah.
And I feel unclean being there. I shouldn't feel that way going to a hospital.
Exactly.
And I always, every time I go there, I always feel like, no wonder why people come here for the smallest things and end up dying inside this hospital.
Right.
Like, just don't feel like,
But sorry to cut you off. Just to address that.
Uh.
I wouldn't say that they're not cleaning,
Right.
They're cleaning,
Right.
they're sanitizing. But the thing is, are they having the proper stuff to sanitize with? That is the concern.
Yeah.
Because you can see them, I tell you, we have maids who, they mop until their back is out.
Right.
Sometimes we have to give them a shot or give them a pill. They do their job.
Great.
But they're not having the stuff to do their jobs with.
Yeah, the right professions in, man.
So nobody at all in the hospital, not just nurses, like you said,
Exactly.
nobody has the proper utensils to complete their job properly.
Because when I'm asking the maid that, okay, where's the hand wash to wash? Oh, we don't have any more. How could you come and tell me as a nurse you don't have any more stuff to wash my hands?
Protocol.
hospital.
Right.
In the hospital.
Protocol for me to be able to enact my job is I have to
to have
sanitize myself.
Yeah.
So I am unable to sanitize myself before I deal with an infected patient
Exactly.
before or after.
Exactly. And then, at a point where you have, oh, well, how am I supposed to dry my hands? There are no more hand towels here. What do I do? Well,
Wring your
they didn't give me any. What are you supposed to do? And this
Oh,
is
that's
what gets you
ridiculous.
upset.
oh man.
This is what, and I kept it quiet and I said nothing for a while until I saw the death of a colleague. And that just raised everything inside
Right.
me. We should not have to die.
Yeah.
And I'm not saying that she didn't have underlying problems, which worsened the condition.
Yeah.
But you put my life more at risk because you did not put in place what needed to be put in place
Right.
Right.
as management.
So they're more concerned about people who are not more in your line of work, so you directly faced with COVID-19 infected patients. So they more concerned with people like us who don't deal with those people on a regular basis about sanitizing and having these things in place. But y'all, they have y'all.
It's with most of what goes on in the Bahamas, it's just a fabrication of everything. You know, they put out these protocols, and I'm not knocking the protocols because they help. They minimize everything, your ability to be transmitted or get this virus. But when you're gonna put that out there, you make sure that the people who are on the front line has those same
protect,
things.
right.
And
Protect those who dedicate to protect others.
Exactly.
Simple as that.
Simply put.
It's crazy. Because, we can go no longer neglect all these things that are going on. But did you know your colleague personally?
Yep,
Wow.
I did.
So, I mean, because that's crazy. I don't know how their family is,
Well,
their course of action they're taking in.
as nurses, because we work and how we work, we really don't get to interact with the other nurses' family. But Bernie, as we used to call her, she was such a bubbly person. Always bubbly and smiling and always have something funny to say. And she was just, I don't know. She was just Bernie. Just loving her job. She coming to work, does what she has to do, give her best. And for her to be left like that, neglected. Let me leave it as that. To be neglected, it's heart-wrenching. It's heart-wrenching as a nurse.
What was their response to her passing?
Watch this now.
They send condolences.
Wow.
Their sympathy, like with anyone else.
No,
And then-
no light bulb effect.
and
No,
then
we got to get these
Everything
people
just
that-
carried on as if it was normal.
Well, I guess after, I had a social media post, and I guess that went viral, and that went to the competent authorities.
So they see what they would like to see.
And, I haven't returned to work as yet. So as soon as I return to work, I'll be on the red carpet. But that's for another time.
Yeah.
I was glad that they saw it. And I will continue doing it until things are in place. And so what happened is they finally found the amazing PPEs.
Ooh.
So now...
Round of applause for our competent officials.
Yes, finally. And so now nurses have the appropriate personal protective gear that they need to carry out their jobs.
8 months in.
Yes. Yes.
Oh,
Yes.
man. That's
Finally.
crazy. So, you've been off this whole time? Why you haven't been back to work?
No, I have been back to work.
Oh, okay.
But I had applied for my vacation from last year, not knowing that this was going to happen.
Right.
And so I had 2 weeks off. And I'm enjoying my 2 weeks, but we have to go back, like I say, in the trenches when I get back.
Interesting. Very
And I
interesting.
miss my patients. You miss the patients. 'Cause
Right.
They're just, you have 17 patients and 17 different dynamics, different characteristics, different attitudes all together.
They all people at the end of the day.
Yeah.
Pardon me?
Yeah. They all people at the end of the day.
Of course they
Right.
are. And, the relatives, and what I always tell nurses, the relatives are not here to care for them. They leave them in our care. And so what we are to do is we act as their relatives. So I have numerous boyfriends.
That's a serious thing.
Yeah. So everyone on the unit is my boyfriend. So I have a boyfriend for every day. And so when I go to work, when I go in the food store, I'm thinking about my patients.
Your boyfriend.
My boyfriend. And so I would bring fruits and vegetables. I'll cut up some watermelon. I'll buy a watermelon and I'll cut that up and take that for them. And
But could you imagine if everyone has that attitude?
but most nurses do.
Right, but not just nurses, and we commend y'all for taking care of those people in the way that they do, because not just their body is probably in dire straits, but maybe they're mentally and emotionally as
Exactly,
well.
exactly.
So we commend y'all, but could you imagine if other people
Exactly. Society as a whole
Right.
have that a concept.
You know how simple it is for you to buy me a fruit? That can make my entire day.
Yeah, it's the small things that count.
Right.
Yeah.
And like I always tell people, they was like, oh, I started helping this one. I said, even before the pandemic, I had persons on Saturdays, when I had Saturdays off, that I go to. There are elderly folks in the community that really can't help themselves. Philip is one of my he's a client that I go to, and he doesn't have to pay me. And he'll say, oh, nurse, I need this or I need that. And I'm like, okay. I said, now, as long as you don't put it on social media, I'm fine. I don't need anyone know what I'm doing for you.
Right. Because then that kind of takes away from it.
Exactly.
Right.
And so, he'll always be there and he'll send me a little message. And that's what we're supposed to do.
Right.
Even a little bit. I don't have much. I have 6 kids. And I do my best with them, And so with 6 kids, if I can help somebody, you think you who don't have any, $20. What is $20? You can go to the food store and you can buy probably a pack of cream crackers and help the elderly. You have a lot of them out there who are not able to do for themselves.
Right.
I saw an elderly gentleman, he walking the other day in the sun, and I was like, I drove past him and I was like, oh my God, no. So I stopped on the highway and everybody was blowing. I didn't care until he walked up. I said, so where are you going? Oh, I have to get to AID. Why are you going to AID? Well, I don't have a light bulb. I was like, oh, come inside the car. Let's go. But where are you going to take me? I said, don't worry. And I went there and I got the light bulb and took him home. He just needed one light bulb.
Right. Didn't have no means.
No means of getting, the bus doesn't work anymore.
Right.
And so sometimes we really need to be cognizant of what's going on with other people and be mindful and
Be
You
grateful.
don't know what
You
people
know?
are going through.
Exactly.
Like, people going through all
and
kind of
that
different
one
things.
little gesture would cost me less than $2.
Right.
Yeah.
Just like
Was
that.
something big. He said, oh, nurse, God, well, he didn't say nurse, miss, God will ever bless your heart.
Right. You don't know how that's going to take him the rest of his life.
Exactly,
Yeah, so I mean, in that line of work, how does it cope with your psyche too? When you have to deal with all these patients and stuff, where you have some grateful and thankful patients, then you have some people who just ain't really cognizant to be that thankful. Some people just outright mean.
Yeah.
And then how you deal with, like, the misfortunate side about things. You grow a bond with these people, families and stuff. Like you say, you have boyfriends, you have families, you have little daughters, whatever relative you want to call them.
Yeah.
And then unfortunately, they might have to pass away. So how do you deal with those stuff from a patient's perspective, like from a nurse to patient perspective?
As a nurse, with our training, we have extensive training. And we deal with that in the classroom. But you're never, ever prepared for a death. You don't care how you prepare yourself. You can see a patient going down, making that journey, and you are never prepared for it.
Right.
You never. For me, I take dying, death, grieving in a different way from others. Some people cry.
Right.
For me, I had one patient who was dying, and I went to his bed. I was like, do you see I try to have some humor in it, but good humor.
Right.
In fair
I know
taste.
what you mean, right.
Yeah. I said, did you see the light? I said, I'm going to journey with you to that light. I said, now don't leave me behind. But, I'm going to walk you there. Certain things you have to find ways of coping.
Right.
And in nursing, I think that's one profession that you find ways of doing, all kinds of ways of doing different things.
Right.
You have to, because you are the patient advocate. When the relatives don't come, and the area where I work, most of the time relatives don't come. So you are their relatives.
Right.
And so when you promise them a pack of cookies and you don't bring it, let me know. So when you promise me a pack of cookies and you promise them a pack of cookies and you don't bring it, they're angry with you. They call you every name, but that's them.
Right.
That's them. And you have to understand. You have to put yourself in the role that you're the relatives,
Right.
and they view you as their relatives. They're only relatives. And so you just have to learn ways to cope.
All right. Let's take one quick break, and then we're going to come back and wrap this whole thing up.
Right.
Hi, this is your favorite zaddy, Lord Jalen Willard from Erryting Kool, and this episode is sponsored by
Special sale alert, special sale alert, special sale for hashtag mask on by Bahamas. The Bahamas America flag mask is currently on sale for 20% off. It is the representation of the Caribbean roots between the 700 islands and keys of the Bahamas and all 50 states of the United States of America. Get yours today. But wait, we have the kids hashtag mask on collection now available and on sale. So log on www.bahawear.com. Get your mask and rep your flag. Camera rolling?
Yeah.
All right. So we back. I don't know if y'all heard that. It is the sounds of solutions, the keys to how we gonna, possibly make our healthcare system a lot better as we, venture on into the future. Now, nothing can be health-wise can be a quick fix, and quick fixes is the reason why we're in the situation that we're in right now.
Yeah.
Mm-hmm.
So,
Yeah.
what are solutions that we could start to implement now that will help us in the future?
Well, I really don't know. At this point in time, there's, like you say, no quick fix. Even in nursing, there's no quick fix. The best thing for health at this time, we need a overhaul of our structural healthcare system. We need a team. I think what we need to do is develop a team that comprises of all within the healthcare system. Let me have a voice at the table. Because someone sitting in the office cannot determine what I go through on a daily basis. They hear me, but they're not adhering to what I would like to see done in my area. And so give me a seat at the table. Give the maid who is working in these areas a seat at the table. Hear our cry, hear our voices, so that we can improve our healthcare system, improve the care that we are giving to our community. And hence, I guess we'll have a better and more efficient and effective healthcare system.
Right.
I think that's the key. If we're going to go into the little details, it's going to take a while.
Yeah.
So, and then also to piggyback, so as part of the benefits of healthcare workers, don't y'all think some mental health initiative needs to be established? Because, you guys deal with a lot of death, and that ain't natural for someone to be seeing, someone here today and gone tomorrow every other day, right?
Yeah.
You're creating these bonds with them. They're becoming like family, and then poof, they ain't here no more.
And see, that's the thing. We have an area set up, which is a community counseling and assessment center. But that's for the public. So why do I, as a nurse who have just experienced a tragic death, say I work in the emergency room, and I've seen a child come in with a gunshot wound, God forbid, and it's traumatic for me because I have children. Why do I have to go and sit up at a center that is set up for counseling with others? Something needs to be done that diversify that setup.
On an individual basis.
Yeah,
Right.
on an individual basis, So, again, nurses are being left in limbo. So, that's, and the thing they like to tell nurses, that's what you signed up for.
Right.
But it's something that we carry with us every day.
You don't sign up for stress. You don't
No.
sign up for,
No.
your life.
PTSD,
Right.
Yeah.
And all of that stuff, right?
Like,
So-
it's a PTSD. Do you feel, because oftentimes people be like, well, the nurses, they don't care. They just let you, let's cause people to die, and they be numb to the situation and things like that. But then it's like, you have to remember these are human beings too.
Right.
Yeah.
And however they coping with the situation, you have to look at all the factors. You can't say that they don't care. It's okay, you overworked, you're underpaid, you overly exposed not only to
Neglected.
not only neglect, but not even overexposed to this pandemic, but you were exposed to other things
All
on a
type
daily
things.
basis
Right.
before it.
All like that.
And then you keep on seeing all this death, so you probably have mental trauma. So it's like, it's either, they're just out of it completely, and we're not addressing the underlying issues, or they feel a lot and they're just, it takes a mental toll on them.
The thing is, they look at us as being strong. And I would not refute that. We are strong, but we hurt inside as well. We grieve inside as well. But we are not to show that. We're not supposed to show that. Because we're supposed to be the ones there who are supposed to be nursing and guiding and encouraging you. But there's no one to encourage us. But you know what it is? That's our job. That's what we're supposed to do. We're not neglecting you. We're not making you wait long. You know how many times and how many nurses have bladder infections?
Wow.
Just
I can imagine that.
Because
when
we
you think
can't
about
take a
it.
break.
Right.
Because by the time you get to work, this is a nurse's day. You get to work at 8 o'clock. Well, we're supposed to be there before you.
Right.
But our shift starts at 8. First thing you do is you check your patients. So we check our patients. We have to ensure that they're okay. If any discrepancy, and you know how they do. Nurse, I need to pee. Nurse, I need to do this. Nurse, I need to do that. So we have to stop. We haven't even checked all our patients yet. So we have to go and deal with that individual. Once that is done, then we have to get a report. So even though we're just coming on and we check our patients, we still have to know how they spend the night or how they spend the morning. So that we will know how to go forth or deal with it. Then after that, the doctors are on the ward. They're coming to check the patients. So when are we going to get a break? We don't have a break. So the doctors is asking, nurse, did she get her IV fluids? Nurse, did she get her oxygen treatment? So we have to be there with the doctors. We still don't get a break. Once we're done with that, we still have to go back and we have to chart. Our biggest thing in nursing is documentation. Documentation could break you or make you in nursing.
Right.
Because if you haven't written it, it hasn't been done. So if a family comes for a lawsuit or anything, you know what the first thing they go for? They're not asking you any questions. The lawyer comes for those notes.
Yeah.
Yeah.
So we have to document.
Go, yeah.
So we have to be on the ball. So whatever the doctors say, we got to write. Whatever we experience, we have to write. And so by the time we're dealing with 15, 20 patients, when do we have time to run off the ward or run to the bathroom and say we got to use the bathroom? So we got to hold it in. And by that time, lunch is there. Giving them lunch, then you have to
Right.
clean them up.
Listen up, right.
And so you have the medication. You have 10 o'clock medication. You have 12. You have 2 o'clock. And so you're giving them that. And so by the time you finish that, you have IV lines to hang. And so nurses are not, and I'm pleading with you, the public, nurses are never neglecting you. Never. It's that their hands are full. They're doing their job. They're doing management job. They're doing sometimes the maid job, because if the maid isn't there, we got to mop up the vomit. We got to mop up the spill, because safety first. And so by the time you look around, the 8 o'clock shift that you came on is now 4:30. It's past your time to get off, but you're still giving a handover to the nurses that just came on. And so only then that you can go take a break.
After your shift is completely over.
Yeah.
Man, that sounds like 9:30 is 4:30 for y'all.
Okay.
It sounds like y'all done work a whole shift in 1 hour.
In 1 hour. And the thing is, the general public doesn't understand that.
Right.
They see you there and they don't know what you're going through, what you're doing. But it's not for me to tell you what I'm doing.
No.
Right.
Yeah. Right.
So how do you think you could give them that message in a way that they would understand? How do you think you could communicate
for
that?
me, when I used to work in A&E, and I always used to tell people when they come there.
I'll repeat that again, because we had
Sorry.
I mean, me
I
or
said,
her?
for me,
No.
what I always tell when I used to work in the emergency room, and it's always crowded in there, and you always hear bad reports. Oh, we've been waiting here long. I said, accident, sorry, ma'am, just hold on 1 second. Accident and emergency is exactly what it is. It's an accident that happened that you couldn't, it's out of
Have
your
no control,
control.
right.
And an emergency, in the event that you have breathing difficulties, heart difficulties, that it's compromising you from moving or going on, that is what it's about. If you get a roach crawl in your ear, that's not an emergency for us, man. If you have some complications from you not taking your medication as prescribed because of your negligence, it's not an emergency for us, but it's a concern.
Yes.
So you will be served in the order that you came in on your level of severity.
Right.
And that's what people don't understand. But we don't have the time to stand up and explain to you because it's an emergency room. It's a fast pace. But you have to, like every other thing, you go on Facebook and the internet, go and research what it is about. So we take you at the severity of your cases.
Right.
And so if you come in there with a baby burning up with a temperature, how long did your baby have a temperature? Oh, she had it from yesterday. So
Right.
it was not an emergency for you. So why is it an emergency for me?
That's right.
But it's a concern.
Right.
Okay? So we'll deal with you. We're going to give you something. Have a seat. But what I give the nurses bad for is you have to make people aware.
Right.
You have to make people aware. Because if an agitated person could come and I will calm them right down. Because they know. We always
Right.
say knowledge is power.
Right.
So take the time to explain. And
To
that's what I
inform
give
people.
nurses. Yeah.
Right.
Take the time to explain what is going on. And people, I would say 90% of the time, the public would adhere.
That'd be good, right?
Yeah.
Because like you say, as much explaining you could do, the next 10% just ain't
Yeah.
cognizant
Yeah.
to
They just don't
understand
want to.
somebody came in there
Yeah.
shot, bro. So
Yeah.
So, do you also think that the government officials are? I don't want to say that they're charging these people who don't want to understand you, the public. They would prefer that they don't understand you, so there's less power that y'all have. If you understand what I'm saying.
I get where you coming
so
from.
there's a public, right? And you said the public doesn't understand your stance.
Right.
And the government officials, they may not want them to understand, so you wouldn't be able to have that kind of
Balance with them.
right.
I think the government does what they met in place. And it's been there from previous governments. And no one has, should I say, the balls to change it.
Right.
And that's why I always call for reform and structural changes. And I think
you all need.
once that is done, I think once we have that reform and those changes done, everything will flow nicely. Everything will flow nicely. Even, as simple as coming into the emergency room. Sir, what is your complaint? Oh, I've been coughing for 3 days. I mean, before this COVID.
Right.
I've been coughing for 3 days.
Normal cough.
Normal
Yeah,
cough.
just a normal cough. And I've been having a diarrhea. Okay, I'll give you an orange card. This orange card is because you're non-urgent. You're going to be here. I'm going to give you some options, sir. Your options is we have some polyclinics. You can go to the polyclinics and you can be seen there, or there's going to be a minimum wait of at least 6 to 8 hours.
What the fuck?
Now, you got to make your decision on what you want to do.
Right.
Okay. So, see, this would be the structural change.
But
Now, it will give you
that's so fair though.
Exactly.
Because imagine if somebody just told you to wait and you waited 6 to 8 hours
it's really
outside
hard.
of you knowing that it's going to be at minimum 6 to 8 hours.
Right.
Right.
And so if he comes to me and he said, nurse, I'm having difficulty breathing, and I could see he's hyperventilating.
Right.
And I know, okay, this man is in distress. He will get automatically a red card. That red card pushes him
It needs to
forward
be seen immediately.
immediately.
Yeah.
And so if they have, and they did that now. They are trying to get that in place now. Where in A&E, they're triaging you. And that's why we have a triage now that tells you, okay, this is what you need and this is what you need and blah, blah, blah. But they're still not, and I give this wrong to the nurses, we're still not being more, we're not educating the public enough when they get there.
right.
Because if we give them that knowledge, and I said, okay, you have a broken toe. It's not life-threatening. Your wait will be a while. Your wait may be minimum of 6 to 8 hours.
Right.
You're going to know that. You're going to sit there 6 to 8 hours minimum. After 8 hours, you will be seen. Maybe you will be seen before that.
Right.
But you have to make the public aware.
Right.
Yeah.
And that's true. That's so true.
Some patience.
But, you know, we would like to thank Nurse Fernander for coming on the show.
Right.
This
Very
was a
enlightening.
very informative talk. Like, you know, I don't think no one else has had this conversation. This is the first time I've ever even heard, like, nurses break down a life of a nurse, especially in these trying times. As y'all are in the trenches, warring against...
On the front line.
On the front line, warring against this pandemic as well as everyday happenings.
Yeah.
But, you know, and I think, you know, it's imperative for us to who have these platforms to spread awareness about, you know, what people like you and others go through on a daily basis and the different misconceptions. Because, like, you know, now we know why the hospital is the way it is, why the nurses the way they are, what y'all have to deal with, and now people can sympathize with y'all and see y'all as human as them. Like, you know, you have grievances or whatever you're going through, and so as these people, like, you know. So we just try to humanize each and everybody and respect.
It's also imperative for us to show our support.
As well as our
Of course,
support.
that's
Right. And not just support vocally. We need to do more in terms of putting pressure on the particular people
Exactly.
to give y'all exactly what y'all need to do
Exactly.
your job
Definitely.
in the way it's intended to be.
Yeah. That's what
It's
it
very unfair for people to do their job ill-equipped.
is. Exactly.
Exactly. And, you know, and also be, you know, fight for the rights of people to share faith, you know. You dealing with these situations, yeah, these people should need to be fairly compensated. And it shouldn't be every year for the last 15 years, the nurses and healthcare workers are striking over fighting over the same issues that for the last 20 to 15 years you've been fighting over. So it's like, you know, we have to correct those issues. We have to make our society better. And it all takes place with us bringing awareness to the issues.
Right.
So, you know. But you know what it is? It's another episode of Erryting Kool. Peace, love. Comment in the comment section below about different questions that you may have. Let's continue this discussion.
Yeah.
Let's continue this discussion.
Who's your least favorite minister?
Who's your
Taking
least
some
favorite
pulls out.
minister?
Oh boy. Careful
Other
how you ask
hospital stories, all that good stuff. But we're going to catch y'all the next time at Erryting Kool.
And make sure, take your vitamins, follow all the safety protocols, and keep safe.
That's
Right.
it. That's
Keep
it.
safe, stay safe. Yeah, see.
All right.
Yeah, you see.
Hey.
Open up